This video is divided into two parts. The second part will be available in the next video. Even experienced doctors often fail to notice that a deficiency of vitamin B12 poses a serious health threat. This is due to the fact that alarming symptoms of vitamin B12 deficiency can manifest themselves even when the level of this vitamin in the blood is within normal limits. This may sound unconvincing, but such is the reality. For this reason, I believe that the current standards for vitamin B12 levels are set too low. The whole issue related to vitamin B12 seems to me to be extremely important. In my story, I will not only discuss the symptoms indicating its deficiency, but also point out who is at risk of its shortage and how to effectively replenish its level in the body. Usually, when most people talk about a B12 deficiency, they mean anemia. Indeed, one of the effects of a lack of vitamin B12 is the development of anemia, more precisely, megaloblastic anemia. Before discussing the symptoms of anemia caused by a vitamin B12 deficiency, I would like to emphasize that the lack of this vitamin causes much wider damage in our body. In my opinion, the health consequences resulting from a vitamin B12 deficiency are more serious than those caused by a lack of iron, which also leads to anemia. However, let's focus for a moment on anemia. A lack of vitamin B12 leads to disorders in the production of red blood cells known as erythrocytes. Specifically, they are characterized by a distorted structure and have unnaturally large sizes. This is where the name megaloblastic anemia comes from. Such deformed red blood cells also have a shortened lifespan and are less effective in performing their functions. This in turn causes a series of subsequent health problems. Individuals suffering from a vitamin B12 deficiency often experience chronic fatigue and constant weakness. I want to emphasize that such increased fatigue occurs not only as a result of increased physical activity, but also during the performance of daily activities such as shopping, cleaning the house, or walking the dog. Generally speaking, people with a vitamin B12 deficiency feel deprived of life energy and often have the sensation as if they have run out of strength. Importantly, rest, including sleep, does not bring full regeneration of strength. Additionally, in the case of vitamin B12 deficiency, there are often also problems with breathing during physical exertion, which is associated with insufficient oxygenation of the body. A symptom of vitamin B12 deficiency, similar to that of iron deficiency, is also a pale skin with a yellow lemon hue. The skin loses its natural rosy color and becomes lighter. Such changes are most visible around the mouth, on the shoulders, and in the conjunctiva. Additionally, it is worth mentioning that a vitamin B12 deficiency can lead to premature graying of hair. Individuals with insufficient vitamin B12 levels may also experience headaches and dizziness, which is partly a result of brain hypoxia. Among the symptoms associated with anemia caused by a lack of vitamin B12, tachycardia or accelerated heart rate may occur. This is a response to damaged red blood cells, which are unable to efficiently transport oxygen to cells, leading to their hypoxia. The heart, in response to this phenomenon, starts working faster and pumping blood more intensely to compensate for the deficiencies in delivering oxygen to cells and tissues. Another consequence of anemia caused by vitamin B12 deficiency is the deterioration of concentration and the ability to maintain attention. Individuals suffering from a vitamin B12 deficiency often experience confusion. A characteristic symptom that may indicate a lack of this vitamin is the occurrence of what is known as Baldwin's tongue. It is characterized by the tongue becoming shiny and smooth, which is the result of tongue inflammation and the atrophy of papillae on its surface. In some cases, there may also be ulcers of the mouth and tongue, as well as burning, often accompanied by pain. As I mentioned earlier, a deficiency in vitamin B12 causes not only anemia, but also, in my assessment, much more serious neurological problems, which in some cases can be irreversible. Vitamin B12 is essential for the formation of the myelin sheath, which protects nerve cells. Its lack leads to disturbances in the functioning of the nervous system, which can result in a series of unpleasant and dangerous symptoms. It is also important that in some patients, neurological symptoms may occur without concurrent signs of anemia. This means that neurological problems do not always have to occur together with the previously discussed anemia. As a result of neuropathy or damage to peripheral nerves caused by a vitamin B12 deficiency, there may be paresthesias, which is a sensation of tingling, burning, and numbness in the limbs. Sometimes there is also a feeling of pricking in the areas of the fingertips, which can even be the first neurological symptom associated with a B12 deficiency. As the problem related to the lack of vitamin B12 worsens, additional symptoms may appear, such as sensory disturbances and weakness in the legs and arms. Some patients with a B12 deficiency also experience reduced coordination of movements and instability of balance. A specific neurological symptom indicating a vitamin B12 deficiency is Lermit's sign, which is characterized by a distinctive pain when bending the head forward or flexing the neck. Patients often describe this pain as a feeling of electricity flowing along the spine, although it is a relatively rare condition. Among other health consequences of nervous system damage caused by a lack of vitamin B12, one should mention problems with urinary incontinence, erectile dysfunction, as well as deterioration of vision and hearing impairment. It is also important to note that a deficiency in vitamin B12 can lead to a decline in mental acuity known as secondary dementia. Fortunately, in cases where we replenish the level of vitamin B12 in our body, there is a chance to reverse this adverse effect. Among the neurological symptoms associated with a B12 deficiency, orthostatic hypotension can also be mentioned. This is a phenomenon that manifests as a sudden drop in blood pressure when changing body position from lying to sitting or standing, leading to the appearance of so-called stars before the eyes. During a vitamin B12 deficiency, psychiatric symptoms can also occur. Some individuals with a deficiency of this vitamin experience mood disorders, anxiety, depression, hallucinations, personality changes, and even develop psychotic disorders. Moreover, it is worth emphasizing that vitamin B12 plays a role in the biochemical processes of our body, especially in the conversion of homocysteine. Homocysteine is an amino acid that forms in the body during various chemical reactions. In the case of a vitamin B12 deficiency, there is an accumulation of homocysteine, i.e., an increase in its concentration in the blood, which can lead to additional health problems. This is due to the atherogenic action of homocysteine, meaning that its excess accelerates the formation of atherosclerotic changes in the arteries. Furthermore, homocysteine exhibits prothrombotic properties, which favors the formation of blood clots in the veins. Therefore, a vitamin B12 deficiency can lead to disorders in the circulatory system. As can be seen, the lack of this vitamin is associated with serious health problems. As can be seen, the lack of this vitamin is associated with radius health problems. That was the first part of this video. The second part will appear in the next video. If you enjoyed this video, please don't forget to subscribe to my channel. Thank you for your support and see you soon.